Welcome to School Life Unpacked, the podcast for anyone navigating the complexities of their child's education. Join me, Natasha Curtis-Ego, and a lineup of insightful guests as we explore the challenges, joys, and surprises of school life, offering support and tips to help us feel more confident and connected. Today we are with a very special guest who is going to enlighten us a little bit about art therapy and how potentially they're little tips that we could use with our children that'll help them through their journey of school life and how they begin school and dealing with those big emotions that perhaps they've not really faced until now. So if you'd like to introduce yourself.
I'm Sarah Ferguson and I'm an art therapist and a mum of 3.
So what exactly is art therapy?
So art therapy is like any other therapy. We just use art as a medium of understanding what someone's trying to express. So it's a different form of expression, especially with children that might not have the words or haven't got the language to explain how they're feeling. They can use art to express those emotions. You can say to a child, how are you feeling? Can you get that out in an image? And they will be able to understand that a bit better than tell me how you're feeling. But art therapy can be used with any age, but especially with children, it's great when they don't have the language.
So it could potentially be a great sort of support as they start school.
Yeah, definitely. It definitely is. Especially when, children, they might be coming away from mum for the first time or dad for the first time. They're meeting a lot of new people all at once. They're longer days necessarily. There's sort of fear, will mum come back at the end of the day? Will mum know where to pick me up? All those little things that the child might be worried about. They get bottled up. The child doesn't necessarily know, oh, I'm worried that you're not going to come back for me, mum, or whatever the fear might be. So with art therapy, you can sort of say to them, draw that feeling or, use this art material to express how you're feeling. Nothing's wrong in art therapy. Nothing is you can't have the wrong emotion. So it's quite freeing for children. There's not a set of rules that they have to abide by. They can just be them and express whatever their body is telling them to do.
So it's quite exciting, especially for, like, I know with my children, I always feel like they're little people with big emotions, but aren't quite there to identify those.
Yeah.
Why am I feeling upset? Why am I feeling mad? What has happened? So I suppose encouraging them to be more arty in a way could help them sort of channel out those little emotions that maybe we overlook.
Yeah, and it can be used both prior to an event happening and after an event happening. So prior to an event happening, you might be trying to reassure the child about what's going to happen, they might hear, what they might see, all the different aspects of starting something new. You're going to be trying to reassure that child, which might then exaggerate the anxiety without meaning to. As adults, we're trying to make sure they feel okay, but actually they're probably not understanding what we're saying 100%. So their anxiety levels are actually going up by us trying to reassure them. So prior to that, you can, maybe help them write a story about someone starting school and what their ideas are about what they're going to experience. And then you're going to understand the fears because they'll be in the story.
Yeah.
They won't be able to say, I'm really worried about this. But within the story, you'll be able to pick out little aspects of where they might be worried. And then, so you'll be able to understand their fears more than your own fears, which as adults, we seem to do a lot where we'll be worried about something. So we have to reassure them about it when they might not even have that worry. They don't have that reality of what they're going to experience. So their worries are going to be different to ours. So understanding what's theirs and what's ours is a really good point for parents to be able to reflect on, because then they're not projecting, they're not putting their stuff on their kids. And then after they've had that big first day at school, you can say, oh, let's write another story about your first day at school. And so it's not just a fictional character's first day, it's theirs. And you'll be able to find out what they liked and didn't like. And you can make pictures, it doesn't have to be a story, but you can make pictures about their first day at school. And you'll be able to see within those pictures who they made friends with, who they didn't, what they didn't like, what they did like, all the fun bits, all the bits that might not have been so fun. They'll be telling you in those pictures their day, and it's up to us adults to maybe sit and reflect with them and maybe not tell the child, but just to be sitting with that information and understanding it as adults of, oh, this made them a bit anxious. So maybe tomorrow there's a different way we can approach that. The leaving mum at the gate, or was it the not knowing if mum was coming back, or was it the going into the canteen with all the strange food and the smells? What was the worry, and can that be approached differently? You might not get that from the kids themselves, but within the pictures you'll see it. Just understanding and being reflective as parents in what's happening with us, and not necessarily always what's happening with the child.
So do you find that, because you've done this for many, many years, and do you find that as a whole in our school life, schools support therapy, or do they implement any sort of therapeutic tricks or tips through a child's life, or is it left for a parent to just completely be responsible for their child's mental health completely? Or do you think schools support them?
I think it varies on different schools have different approaches, and down to different teachers as well. Different teachers will have a different approach. You'll get one teacher that's very open-minded, very relaxed, very reflective, and will treat each child as that individual and do what that child needs. And then you'll get other teachers that are a bit more strict, and this is the rules and this is how you behave, and that's it. But on a general scale, most schools will have some sort of mental health provision, whether that be a third-party organisation of therapists that come in as and when they're needed. So they might have a child that is showing behavioural issues or emotional distress, and they will call an art therapist in, or a counsellor or whatever for that child specifically. Some schools have in-house counsellors, very rarely that I've found in our local area anyway, that will have in-house counsellors where they will just get referrals of the children as and when they're needed. And then some schools even have sort of reflective spaces, so they'll have like a cosy corner for kids to go in, and then they might have a teacher that comes and checks on them in there and helps them sort of be present and find where they are and settle themselves and ground themselves to be able to go back into class. Yeah, but again, it depends on the schools.
Is that open to all children? I know it depends on the schools, but do you think that kind of support is only given to children who are obviously in need? Or do you think that maybe it should be something that is more spoken about with everybody? Because I know mental health is such a big thing at the moment, but I'm trying to see how that filters into our children, and how is it present from that they arrive there, or is it something that actually only gets introduced maybe year 4, 5, as they start to sort of grow into who they are a little bit more, or is it from the beginning?
Yeah, I think again, it's dependent on the school, but most of the time it's for those children that are showing a distress of some kind, whether that be behavioural or emotional, whatever. Most teachers will flag that child up because they're seeing signs that something isn't quite right, or they want to investigate a bit more about what's happening to that child, what's disturbing that child, what's upsetting that child. What there is a slight education of mental health now in the school system. But when I say slight, I mean slight. Like, there will be conversations about it here and there, but nothing overly, formative. So the child might learn a terminology, but whether they understand that terminology or not, is a different thing. They might learn the words around mental health, but they might not understand actually what those words mean. And there's some schools that do sort of like yoga and stuff like that, which is great, to exercise the body and be reflective and mindful. That's great, but it's not continued. It's not substantial enough to have a large impact on that child. They might do it like once a term, like every so often, or it might be part of the PE lesson at some point in one of the years. I know one school that had a yoga club in the mornings before school once a week and stuff, which is really great. But then other kids really understanding how to use that as to help them when they're feeling overwhelmed. Because it's all well and good to say, we're going to do a bit of exercise and it's going to calm you down in this moment. That's great. But to give the children the skills to take that further in terms of understanding, oh, I'm getting a bit mad, or I'm getting a bit uncomfortable, or when they're being triggered, and don't understand why they're being triggered, or even they're not even going to know the word triggered, but they're going to know that their body doesn't feel right. So will they know to go, oh, maybe I'll take a deep breath now? Or, like we did in yoga class. Are they going to relate the two situations? Probably not.
Yeah.
So that's where the education needs to come in.
So going back to what you said a little while ago about knowing the terminology but not understanding it.
Yeah.
I suppose a lot of parents will ask those questions. Can my 4-year-old be depressed? Can they have anxiety at this age? I mean, those are such big terms.
Yeah.
I'm like, I can't imagine a 4-year-old feeling depressed. Are these things that we should be looking for, or actually is it that they're having a sad day and we need to just help them to work through it and unpick what that emotion is and what led to it?
Yeah, and I think that's the point. I think as parents, one of our jobs is to teach our children how to regulate themselves, how to know what they're feeling, why they're feeling it, and what to do with that feeling. As a parent, I think that's really important. And we might not know that ourselves sometimes as parents. We get overwhelmed and anxious and worried about all sorts of things. But we have the understanding somewhere in there to say, oh, maybe it's, this meeting I've got coming up that's stressing me out, or the bills I haven't paid. Like, we can pinpoint our worries. But as children, they can't. They can't understand that they're worried because they heard mum talk about something that's going to happen next week and they're not going to be there for that. So they can't join the dots together on why they're being anxious. And it's okay for them to feel like that. I think that's the thing, to validate their emotions and then to help them understand it, and then to say, okay, what will make us feel better in this situation? What can we do that's going to make us feel better? And it might be, let's just go outside and play. And we just change the environment, change the mindset. And that doesn't fix the problem, but it shows them that they can regulate their emotions and that they don't have to just get stuck in that, I feel like this and that's how I'm going to be. There's ways to understand what's happening to your body and move forward.
I suppose that is it, isn't it? It's understanding. But as a parent, if we're not quite understanding, it's hard to encourage your child to understand it. But I suppose it could also be a positive journey that you both take together, that getting to know who you are and getting to know who your child is and how you're going to follow through. Because I think school is an extremely stressful time, not just for your child, but like you said, for a parent, and you worry about everything. Will they fit in? Will they eat? Will they know that I'm coming to get them? And you get personally, I got very nervous. And I remember thinking, how are you going to get through the day if I can't get through the day? And it was trying to push that aside and try and only deal with what she was going through as she started, in hope that we'd get through it together somehow. But I suppose it is, like you said earlier, identifying what it is, what are my fears and what are her fears.
Yeah. And it's okay to say to your kids, Mummy's worried too. That's fine. Mummy can be worried, because then they know that it's not this strange feeling that they're all alone with. It's a big change for both of you, or whoever that caregiver is. It's a big change, and it might be for the longest period you've been apart since they were born, or, on a rare occasion. But it's okay to say, do you know what? Mummy's a little bit worried as well. But it'll be okay, and that's okay to feel worried. Do you know what I mean? You've got to validate their emotions and sit with it. And sometimes that's all you can do. You can't take it away. You can't change it. You can't tell them that that's wrong. That's how they feel. But we can sit with it, and it can be okay, and it's going to be okay. We're worried. What will make us feel a little bit more comfortable in this moment? Let's have a cup of tea. Let's have a little biscuit. Let's play a game, and it is a bit about distracting from that emotion, but it's a little bit about, it's okay to feel like this, but we can feel another way, or we can do something that's going to make us a little bit more comfortable with that feeling, and we can sit with it together. And tomorrow we can see if we're not so worried because we've got through it today. So there's a journey there to be taken. You can't just dismiss it and hope that they're never going to feel it again, because we all know that's not true. We can only avoid something so long, and then it comes back round, and it comes back round worse more often than not. because we've not dealt with it in the first time.
Regulating emotions for a child is so important because you need that. Like, that's, I suppose it is a foundation skill, isn't it?
It's definitely part of your platform mental health learning. If you haven't built that platform up as an adult, it's very much, you're starting on a back foot on how to regulate yourself as an adult. And I know we've probably all met adults that sort of lose their ability to think, or lose their anger quite quickly, or get aggressive in situations that don't necessarily need it. And as adults, we meet these people in our lives where you think, well, that was a bit of a strange reaction that person had, and it's probably because their emotional regulation hasn't they haven't emotionally regulated themselves over a long period of time to understand why they react like that. Whereas if they were a bit more reflective at times and could see, well, what makes me mad about that situation, then that behaviour would slowly change over time. But it does take a long time. It does take a long time to regulate yourself and learn yourself what makes you tick. But with children, they can't think like that. We have to do that thinking, and then we have to give it back to them in a way that they're going to understand, in an age appropriate way, with terminology that they understand, and with skill sets that they can then take forward.
So that's why art therapy is great as a starting block, right? Because
Definitely, yeah.
Kids love to draw, and their drawings always tell you something. So it opens that window of opportunity to work together.
Yeah.
So if you were to give parents a few tips of something that they could, I know you mentioned earlier about sitting, doing the story together, but are there any other things that you found really useful, maybe with your family, where you've actually brought them from your professional side and thought, actually, this would work really well at home and other parents could be doing this too and it would be of benefit?
I think number one is to ask your children how they feel. Try not to go, was you a bit scared today? Or, what was worrying? Or what was strange? Or what was different? Don't put the words in their mouths. Just ask them, how did you feel today? They will tell you. And if they don't, that's fine. You can go around that other ways. But try not to put words in their mouth. Try not to say, you will feel like this. You may feel like this. Or that may be a bit different. You understand your language that you're talking to your child with, because they will pick up the words. So use your language, be reflective yourself, understand your own, what's going on for you, and then practically use art as a way to help your kids express, and storytelling. It might be music, it might be dance. Anything creative, anything with the body, and anything that moves the body will be great to get that child to express their built-up emotions. And they may never tell you the words that they are feeling, but when they're dancing around a room, or they're throwing something at a wall, or I work a lot with clay, and a lot of the kids will just throw the clay at the floor, and that's fine. They've had a bad day and they're getting that out. No one's getting hurt. Nothing's getting broken, but they are getting that emotion out of their body. So that's okay. And destructive behaviour isn't always bad. There's a need for it. There's a place for it. Make it safe. Make it maybe a bit fun. Make it reflective. It's fine.
On that note, I think we've come to an end. But thank you so much, Sarah, for your time and joining us on our podcast. It was really amazing to just listen to how there are things we can do as parents that we don't think of doing. I know we all draw with our kids, or give them a pen and paper and they scribble, but to take the time out to talk about those drawings and work through it and use it as a way to communicate, just opening that door and allowing them to learn how to self-regulate, as a parent, and also maybe allow us to self-regulate a little bit more and see where we are, is a wonderful opportunity. So thank you for highlighting all those things.
You're very welcome.
Thank you. Thank you for joining us on today's episode, and we truly appreciate you listening. Don't forget to turn on your notifications, subscribe, and follow to stay updated on future episodes. We look forward to seeing you next week.